How does reproductive anatomy actually work for fertility? Imagine the journey of a tiny cell that holds the potential to create new life. That cell starts its journey in the ovaries, which are small, oval-shaped glands located on each side of the uterus. These ovaries do two main jobs. They produce eggs, called oocytes, and they releases hormones like estrogen and progesterone that regulate the reproductive cycle. Inside each ovary are many follicles, which are fluid-filled sacs that contain immature eggs. During a typical menstrual cycle, several follicles begin to develop under the influence of a hormone called follicle-stimulating hormone. Usually, only one follicle becomes dominant and fully matures into a Graafian follicle. This mature follicle completes a process called meiosis, preparing the egg for releases. Around day 14 of a 28-day cycle, this mature egg is released from the ovary in a process known as ovulation. Once the egg is released, it is caught by the fimbriae finger-like projections at the end of the fallopian tube closest to the ovary. The fallopian tubes act as a pathway, guiding the egg toward the uterus. Fertilization typically happens in the widest part of the tube called the ampulla. Here, sperm meet the egg and penetrate its outer layer called the zona pellucida. This layer helps prevent multiple sperm from fertilizing the same egg and helps sperm bind and enter the egg. If a sperm successfully fertilizes the egg, the resulting embryo begins its journey toward the uterus. The uterus is a muscular organ with a lining called the endometrium. After fertilization, the embryo travels down the fallopian tube into the uterine cavity. The endometrium thickens under the influence of hormones like estrogen and progesterone, which are produced by the corpus luteum, the remnant of the follicle after ovulation. This thickening creates a welcoming environment for the embryo to implant. If implantation occurs, the embryo embeds into the endometrial lining, and pregnancy begins. If fertilization does not happen, hormone levels drop, and the thickened lining is shed during menstruation, marking the start of a new cycle. Hormonal regulation is key to this process. The hypothalamus in the brain releases gonadotropin-releasing hormone, which signals the pituitary gland to produce follicle-stimulating hormone and luteinizing hormone. FSH encourages the growth of ovarian follicles and estrogen production. A surge in LH triggers ovulation. Estrogen and progesterone then work together to regulate the cycle phases and prepare the reproductive organs for potential pregnancy. During intercourse, sperm are deposited in the vagina. From there, they swim through the cervix, which produces mucus that changes consistency throughout the cycle to either help or hinder sperm movement. The sperm then travel through the uterus into the fallopian tubes, where they may meet the egg. Understanding this normal process helps us see how conditions like endometriosis can interfere with fertility. Endometriosis involves tissue similar to the lining of the uterus growing outside it, often on the ovaries, fallopian tubes, or pelvic lining. This can cause inflammation, scarring, and even blockages that prevent the egg and sperm from meeting or the embryo from implanting. Such disruptions can significantly reduce fertility. Recognizing how each part of this system works highlights the importance of medical treatments and interventions tailored to individual needs. In summary, female fertility depends on the precise coordination of the ovaries, fallopian tubes, uterus, cervix, and vagina, all governed by a complex hormonal cycle. Disruptions in any of these parts, such as those caused by endometriosis, can make conception more difficult. Always consult healthcare professionals for personalized advice and treatment options.